This Skilled to Work story is sponsored by Etowamba Community College.
Labor shortages are hitting all corners of the medical field, including respiratory therapy. Respiratory therapy is the specialty in medicine that focuses on a person's ability to breathe, a practice that was highlighted during the pandemic. I show you how you could become a respiratory therapist in just 2 years in this week's Skilled to Work. Motivated, calm under pressure, and always adapting.
On any given day, you're carrying a phone or a pager and you have to respond to every adverse event that happens for a critical patient or an ER patient.
Respiratory therapists are trained to deal with conditions affecting the lungs and heart, like asthma. But RTs also handle the highest acuity cases, which means they keep the patients alive when things go south.
We're probably one of the only 2 or 3 people in the hospital at all hours of the night, along with the nurses and docs.
And if you like the excitement and intensity that is shown on TV hospital dramas,
it's definitely an opportunity for you to enjoy respiratory care.
But don't get it twisted. Respiratory therapists are the ones operating the life-saving equipment.
On TV you see it, and a lot of times it's the doctors doing everything, but in the real world it's one doctor, maybe 2, and then a bunch of nurses and respiratory therapists performing most of the work.
Adam Denton has been a respiratory therapist for more than 20 years and is currently over the respiratory care tech program at Etowamba Community College. He says there are some courses you would need to complete before you can enroll into this program.
Prerequisites are anatomy and physiology 1 and 2 and an algebra component. So that's the only thing that's required to get into the program.
Employment of respiratory therapists is projected to grow 23% from now until 2030. The average salary for respiratory therapists is more than $60,000 a year.